Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The effects of bug bites can range from mild itching to severe allergic reactions. Today, we'll talk about the various types of bug bites, how to treat them, and when to seek medical care with my guest, Dr. Zachary Shepherd. He's an associate professor of medicine who specializes in internal medicine at Upstate. Welcome back to The Informed Patient, Dr. Shepherd.
Thanks. It's great to be here.
Some bug bites we know about right away because they hurt. Others, maybe we wake up and find a bite on our body. How do we assess how serious of a bite we have?
Most bug bites are not serious. Most of them go away on their own. Most of them are mild nuisance for a little bit and then disappear. Some of them a little bit worse than that, but most of the time they're going to go away on their own and there's not anything to worry about.
Does the size or the color or the texture of the bite matter, or if it's painful or not?
A lot of times they will be painful, they will burn, they'll itch, but the thing to look out for, I think, is if they're getting worse over time rather than better. Most of the time they get worse for a little bit and then they get better over time. One of the other things to look for is redness that spreads out from the bug bite. So you'll get some little bit of redness that'll come out. Usually it will be what we call self-limiting. So it'll pop out and then it'll go back in. But if it starts to spread pretty far outside that area, we recommend to be seen. Another thing to look for is if there's pus or drainage that's kind of ongoing and it seems to be getting worse, or pain that keeps getting worse, right? Or swelling that keeps getting worse. So you hear me say getting worse a lot, right? So if it's not kind of getting better after an hour or so after the sting or bite, then probably should get somebody to check it out for you.
Do you ever see that a patient has something that they thought was a bug bite, but it turns out to be something different?
Oh, absolutely. There's lots of different things that you can find on your skin, from the benign to the not so benign. Shingles can pop up every now and again. That's really painful. It usually comes in like a big wrath of things. So you get like a big line of them, right? Sometimes people think they've been bitten by a spider because they'll have a little pimple that turns into a little bit bigger, like an abscess, which is like a big pimple. And sometimes people think they got bit by a spider, but they usually don't. So if you didn't see the spider, you probably didn't get bit by it, is usually the way to think about spider bites.
Which insects or arachnids have sent the most patients to see you?
So I'd say tick bites most likely. There's a lot of worry about Lyme disease and things that you can get from ticks. People find ticks on themselves. So I think that's probably the one we see the most.
So what do we need to know about tick bites?
Tick bites, there's a lot to know, right? Prevention is always key, and we can talk about that as well. But when you get it, when you find a tick on yourself, you always want to remove the tick. So you get some tweezers and you grab it by the base of where it's attached to and pull it right out. There's a whole lot of swirl about how to get ticks off, and you put Vaseline on them, or you burn them, or you do this, or you heat them up. I recommend none of that. In fact, the only thing you should do is grab some tweezers and pull it off, right? Because when you irritate the tick, it's actually can make it more likely that they transmit the disease. So you don't want to do all these interesting ways to get them off. Just grab them, pull them right out.
So should you save it and bring it to the doctor, or what do you do with the tick once it's off?
No, generally it's not necessary to bring it to your doctor. The thing to look out for, and what they'll tell you, is that ticks really need to be on for more than 24 hours to really probably give you any kind of the communicable diseases that ticks have. But it is obviously hard to gauge how long they've been on there, right? But if they're tiny and they're not engorged at all, which means swollen, then they probably haven't been there. If you went hiking this morning and found it this evening, you're probably okay. But either way, what you're going to look for is something that happens afterwards, right? So a few days to weeks, there can be a rash at the site of the tick bite, or there can be kind of a flu-like symptoms. That's when you really need to pay attention and talk to your physician.
And if when you're trying to take the tick off, if it breaks and there's still some of the tick left, is that something you would need to go to the doctor to have help doing?
Absolutely. Yeah, I think if there's still remaining bits of the insect that you can't get out or see, then yes. A lot of times, though, you have to be careful with that because it'll look like there is. But what you do is you inspect the tick when you pull it out, right? Usually they're pretty sturdy. They don't come off very easy. But that's why you don't play with them. You just grab them, pull them.
How do you differentiate mosquito bites from spider bites?
It depends on the spider. I would say that spiders don't bite us in New York, right? They do, but it's pretty rare and they're rare to cause anything. They usually hurt a whole lot for a little bit and then they get better. Mosquito bites are more insidious. You get a mosquito bite, they happen in kind of clusters. Sometimes you usually have more than one because you get bit by mosquitoes, not a mosquito, but that's not always true. Sometimes it depends on the person, but you can barely feel it bite you. But then you'll notice an itchy spot, a bump, and a tiny little hole, it seems like, in the mosquito bite, right? So it'll be real itchy. But spider bites are usually singular, and you usually see the spider. You stuck your foot in your shoe or something like this, but there's not a lot in New York that you need to worry about from spiders, to be honest.
But like with ticks that carry bacteria or viruses that can cause diseases, there's mosquitoes that carry potentially dangerous viruses, right?
Yes, that is true as well. And this is why we should talk about prevention of bug bites at some point, because mosquitoes do carry Eastern equine encephalopathy, West Nile virus. There's a lot of scary sounding things out there that should sound kind of scary. They're really rare to actually happen to people, but when they do, they can be pretty serious. If you look up, I think in New York, there's been a couple of cases over the last few years, but even though there's only two, I think last year, it's still pretty devastating for a person because Eastern equine encephalopathy carries a mortality of like a third, right? That's why they spray for mosquitoes sometimes, and that's why we really encourage people to use preventative measures.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking about bug bites with Dr. Zachary Shepherd, a doctor of internal medicine at Upstate. Are bed bugs or flea bites ever dangerous?
They're not so much dangerous as something that you can do about being preventative if you can, or getting rid of them. They don't much cause other disease or carry other things that will make you sick, but you can get infection from pretty much any bite. Anything that pierces your skin, even scraping your knee or sticking yourself with a knife or a pin somewhere, can lead to an infection. So usually it's your own skin that infects you, but most of the time they're just a nuisance and something you need to get rid of.
With so many varieties of ants, which ones do we need to be concerned about the most in central New York?
So fortunately, the climate in central New York, there are no species of ants that are really that dangerous. They're more of a nuisance, sugar ants and carpenter ants and things like this. We don't have any red ants or fire ants that I've heard of. So I don't see any ant bites. So I would say leave them alone if they're not messing with you, and you should be just fine.
What about fly bites? Because I know at certain seasons, black flies are biting, particularly up in the Adirondacks, horse flies. Are those something that could ever be beyond a nuisance?
No, other than pain. The black flies, horse flies, they can be really painful. They can swell and get infected too, but it's very rarely dangerous.
What about with bees and wasps?
Bees and wasps generally also are just painful and scary, but you do have some people that can be allergic. You can technically be allergic to anything, but bees and wasps are something that some people are very allergic to and should look out for what we call systemic signs, which are signs outside of where you got stung. So if you get stung by a bee and you suddenly have welts all over your body and these red itchy spots everywhere, then you need to go to the emergency room immediately. You probably should call 911 and get there quickly. Or shortness of breath, or you feel like you're wheezing, which is like this sound you make when you're breathing that you don't normally make. Either one of those, you should probably see the ED because you might be allergic and have what we call anaphylaxis. And if that's the case, you need to be treated at the emergency room. And you also need to carry an EpiPen. And how do you figure out if you're allergic ahead of time? An allergist can help you, but generally people find out after they get stung. And it does matter how much you get stung. So like if you get stung by 5 bees, there's much more likely that you're going to have an unhappy time than if you got stung by one. I feel like that's kind of obvious, but it's also really just true for allergies and anaphylaxis. The other thing that happens too is as soon as the people don't have that, what I was talking about, anaphylactic reaction, the first time they get stung, it's the second time or third time. So sometimes that sensitizes you because you are allergic, you just haven't found out yet.
What is an EpiPen and how would someone know if they need to keep one with them?
So your doctor will definitely tell you if you have allergic reactions to things and you have what I talked about anaphylaxis before, that you need what we call an EpiPen. So an EpiPen is epinephrine in a pen. hence the name EpiPen, right? So what it is basically a device that you can deliver into your leg, a medication that counteracts the anaphylaxis we were talking about earlier. It is a life-saving thing that you carry around. The other thing I want to emphasize here too is that if you have to use your EpiPen, you better still come to the emergency room, because most people have a biphasic anaphylaxis reaction, which, I mean, it'll happen again, right? So the first wave that you get and you need your EpiPen, you're going to have another wave, because epinephrine's not going to last long enough to protect you. So you still need to come to the ED.
So it's not a substitute for the emergency department, but it gives you time to get there.
A bridge to the emergency room. That's a good way to put it.
That's a scary and dangerous situation, anaphylaxis. And fortunately, that's relatively rare. Let me ask you to walk us through what sort of care we can provide at home for bug bites that are not causing anaphylactic reactions. How do we clean the bite and take care of it?
Just soap and water. Soap and water whenever you get bit by most things or any kind of cut. Soap and water is probably the best thing to put on there. And if it's itchy, you can take an antihistamine, or you can use a topical cream like hydrocortisone.
How do we tell if the swollen area is expanding?
You just watch it over time. One thing you can do too is it's usually discolored from your usual skin. You actually mark it with a pen and circle it. That's very helpful. If you ever come to the hospital or clinic and see me, I'm going to get somebody to write on you around that edge of that redness so we can watch it.
Now, you talked about the allergic reaction, the severe allergic reactions like anaphylaxis, but what are some of the other things that we ought to keep an eye on for any bug bite?
Really, the two is infection and allergic reaction. So infection, you're going to look for that redness spreading out from it. We call it erythema. If it's spreading out rapidly in particular, so if it's several inches and it's still moving after the initial sting. So the first sting is going to expand a little bit over an hour or so at the most. But if it keeps going, then that's a really big concern. If the site itself just really continues to hurt and swell worse and worse over time, that's another reason you should see somebody. And then same for if it's leaking, pus, that's another sign that's infected, and you may need to have it looked at.
And I think you said earlier regarding like tick bites, but maybe this would apply to every kind of bug bite. If there's symptoms that develop over the next few weeks of flu-like symptoms, a rash, that's something to talk to your doctor about, right?
Absolutely. So 3 days to a week or a couple weeks out is when you can develop some of the flu-like illnesses that come with some of the communicable diseases you get from ticks and other bugs, right? So you want to keep an eye on that, and the sooner the better once you come in.
Now, if it's after hours, do you ever recommend people call the Upstate New York Poison Center about bug bites?
Yeah, I think if you're concerned about it, you certainly should. Most bug bites that aren't, as I said, self-limiting and start to resolve on their own, if you're really worried about it, you can call them and they can give you guidance as well.
And I'll just share the number 1-800-222-1222, 24 hours a day for the Upstate New York Poison Center. Now, before we wrap up, let's talk more about prevention. What do you tell people in terms of DEET? Do you recommend that or not?
I do, absolutely. There is two preventative measures that you can use topically to prevent bug bites, particularly mosquitoes and ticks is the ones we're most worried about. And you should use them even when you're just going to mow your lawn or going for a stroll outside. Anytime you're going to be touching grass, as they say, you should probably put on one or the other. Now, especially hiking, especially going out in the woods in particular, but DEET and Bicardin are the two safest topicals that we have. Both of them have been studied extensively. And even though I know that DEET is very safe and very effective, I still have that stigma that we all seem to have about it. There's these stories that kind of swirl around and kind of make people lean away from DEET as if there's some danger to it. But over 50 years, we've not been able to show any danger to it. It's actually very safe. It is kind of disconcerting because it's oily and it kind of smells funky. And I actually picked some up to see what it smelled like and play with it just before we did this. And it can melt plastic too. Like some plastics, it'll kind of irritate, but it's very safe. So it seems more harmful. Picardin, on the other hand, is my preferred because it doesn't smell like anything. It doesn't really leave any film. You barely even notice that it's on. And it's just as safe. We only have about 10 years of data, but it seems very safe with kids, very safe with adults, same with DEET. So the gold standard is DEET, But I think the most important thing is either one of those, whichever one you'll stick with is the most important.
And you emphasize how safe it is. What about for people who need it every day if they're a farmer or a landscaper?
Safe every day. Yeah, you can definitely use these all the time, anytime. I mean, it's surprising how much swirl there is around DEET when it's extremely safe. Even I had some biases against it until this interview because I just used Bacardin because I don't like the heavy smells anyway. But I didn't realize there actually wasn't problems with DEET. There weren't actual studies showing us that there were problems with it.
Well, that's really good to know and very helpful advice. Thank you so much.
Absolutely.
My guest has been Doctor of Internal Medicine, Zachary Shepherd. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.